Case Study 8. 3 days ago, 28-year-old male was admitted to ICU with the condition of weakness and hypotension. 4 days prior, the patient was beaten while hiking. As the ambulance arrived, patient showed symptoms such as large hematoma on left arm, moderate respiratory distress, continuous bleeding, cool skin, and mild jaundice. Patient do not have medical history, take no medication, and no drug allergies. So, here is the lab finding on the test.
The first question states that we have to explain the clinical manifestations of the patient based on the lab findings. So, the first symptom or manifestation that is shown by the patient is weakness. Weakness can be caused by many factors such as anemia and hypotension. The patient is experiencing low blood pressure due to prolonged duration of bleeding. This causes the oxygen supply in the blood to decrease and the muscles receive inadequate oxygen to function well. Thus, the patient feels weak. Lab results also show that the hematocrit levels are low, indicating that there are low levels of erythrocytes in the body. This can also explain why the patient feels weak. The next sign or symptom is moderate respiratory distress. This occurs when the lungs are filled with fluid. This lowers the amount of oxygen in the body, making it hard for the patient to breathe. Respiratory distress can occur due to sepsis and pulmonary hemorrhage caused by pulmonary emboli. Pulmonary emboli can be caused by hypercoagulation, which can be seen in the laboratory test results.
Another clinical manifestation of this patient is hypotension. Hypotension can be caused by hypovolemic shock, dehydration, heart disease, and internal bleeding. In this case, patients suffer with venomous snake bite that cause internal blood bleeding to occur. This condition presents with low platelet count and prolonged bleeding time, which shows increase in blood loss and also less oxygen and nutrient supply to vital organ. This indicates poor blood circulation result in hypotension. Hematocrit level also decrease, indicate low level of red blood cell present in the body. Other than that is cool skin condition. Factors that can cause skin to cool such as hypovolemic shock, poor nutrition, traumatic injury, or hypothermia. The process involved in this condition is almost the same as hypotension. So basically, poor blood circulation can occur in this patient body due to an increase in blood loss that causes less blood oxygen and nutrient supply to body tissue and cell. This results in manifestation of the cool skin condition. Laboratory test results show low hematocrit level in the body, which explain this symptom.
The next clinical manifestation is large hematoma that exists on his left arm. Hematoma usually is caused by bite and also surgery, but in this case, patient was bitten by a snake that will cause the damage to the blood vessel, allow the blood flowing to the surrounding tissue and cause the hematoma. The patient also show mild jaundice. Mild jaundice is due to the excess bilirubin in blood. Bilirubin is produced by the breakdown of the red blood cell, but in this case, a low level of hematocrit, which is due to the hemolysis of red blood cell, which then produce excessive bilirubin. Then it will cause the mild jaundice. The last clinical manifestation shown by the patient is the continuous bleeding. Continuous bleeding is because of the poisonous bite that contain anti-clotting agent which prevent the blood from clot. In the lab investigation, the patient showed also low level of platelet, which cause the blood clot cannot be formed. The patient also show the presence of D-dimer, which indicate there is a clotting disorder.
Based on the normal laboratory findings, we can see that the hematocrit level and platelet count is lower than normal average. Also, the bleeding time is longer than usual. And the normal range for hematocrit is 38.8 to 50%, while platelet count is 120,000 to 440,000 milliliter, and normal bleeding time is 1 to 9 minutes. The hematocrit level and platelet count low may suggest that this patient has a bleeding disorder. Hematocrit result can be used to measure the amount of red blood cell in the blood. Also, the red blood cell contain hemoglobin that carry oxygen to the cell body. Platelet count is to measure the number of platelets in the blood. Platelets important for the blood clot and prevent excessive bleeding and detection of any bleeding disorder. As the lab finding shows that the bleeding time is prolonged, it may indicate that maybe there are abnormalities in platelet function and can be suspected with bleeding disorder caused by thrombocytopenia. The bleeding time usually used to assess platelet function and body's ability to form clot to stop the bleeding. The higher bleeding time may caused by clotting factors deficiency. When our skin is injured or broken, platelet clumps together and forms clot to stop the bleeding. But when you don't have enough platelet in your blood, your body can't form clots. A low platelet count may also called thrombocytopenia. Thrombocytopenia is a condition where you have a low platelet count. Platelets is a colorless blood cell that help blood clot. This condition can range from mild to severe depending on its underlying cause, and this patient is suspected to have a bleeding disorder due to thrombocytopenia.
Next is about prothrombin time, PT, activated partial prothrombin time, APPT, fibrinogen, and D-dimer. Here it shows that the normal range for the PT, APPT, fibrinogen, and D-dimer. In these lab findings, we can see that PT and APPT is higher than normal range. Then the fibrinogen level is lower. Also, there are presence of the D-dimer in this patient blood. The PT and APPT is used to measure the time of the blood to clot. Usually, the time of the blood to clot is only taken for within seconds. But in these laboratory findings, we can see that PT and APPT is prolonged than the normal time. This is due to the abnormalities of the coagulation factors in both extrinsic and intrinsic pathway. A prolonged PT and APPT means that clotting is taking longer than usual. Next is fibrinogen. Fibrinogen test is used to measure the amount of fibrinogen in the blood. Also, fibrinogen is a clotting factor that helps clotting the blood. So, because of the fibrinogen has lower value than normal, means that the clotting may be prolonged. The finding also shows that there are presence of the D-dimer. D-dimer is a protein fragment from the breakdown of a blood clot. Blood clots generally start to slowly break down after they are formed, and this process releases D-dimer into the blood. The presence of D-dimers in plasma or whole blood indicates that fibrin has been formed and degraded. D-dimer is also a marker of a fibrin degradation that is produced by thrombin and plasmin. Plasmin can also degrade intact fibrinogen, generating fibrinogen degradation products, FDPs. The presence of the D-dimer can confirm that both thrombin and plasmin have been generated, since it can only be produced as the result of the plasmin degradation of fibrin. D-dimer are the result of the breakdown of cross-linked fibrin by plasmin, while fibrin degradation products FDPs are the result of breakdown of fibrinogen and fibrin when cleaved by plasmin. D-dimer can also known as FDPs. It is named as such because it contains two cross-linked D fragments of the fibrin protein. D-dimer and FDP can become elevated whenever the coagulation and fibrinolytic system are activated, where increased level may imply increased fibrinolysis, and it can be seen in DIC.
On this lab test, the renal function test is also being tested, such as BUN and creatinine levels. Both BUN and creatinine levels in this patient are high compared to normal value. This may be due to possibility of dehydration and also acute renal failure. Creatinine test is used to measure the amount of creatinine in the blood. Creatinine is a waste product produced by muscles and removed from the body by kidney and through urine. BUN test is used to measure the amount of nitrogen in the blood that comes from the product of urea. The breakdown of protein to amino acids will produce ammonia. Ammonia contains nitrogen that is toxic to the body. Ammonia converts to urea. Urea carried to the kidney and excreted out through urine.
Next, we go to pathophysiology of DIC. When the snake bites, it will produce the venom that activates the coagulation cascade of thrombin that converts fibrinogen to fibrin. The breakdown of fibrinogen and fibrin will result in polypeptide called fibrin degradation products, or also known as D-dimer. Tissue factor will also be released and will be exposed to the circulation after vascular damage. The clotting factor are consumed in the development of multiple clots, which contribute to the bleeding seen in this DIC patient. The breakdown of clots result in an excess FDP, contributing to hemorrhage. This snake bite can cause massive activation of coagulation cascade, and this will result in a marked increase in thrombin production. This excess circulating thrombin will result in multiple clots and tissue ischemia. Platelet aggregation happens at the site of this clot, and tissue ischemia will occur. Lastly, impaired organ perfusion and end organ damage results from this impaired microcirculation. Consumptions of platelets, fibrinogen, prothrombin, and factor 5 and 8 that involve in the coagulation cascade in the presence of unchecked coagulation will lead to excessive bleeding. Based on the lab finding, we conclude that this patient is having DIC caused by the bite from the venomous animal.
Disseminated intravascular coagulation DIC will mainly lead to prolonged bleeding and thrombosis. Now we're going to focus on intravascular deposition of fibrin that further develop into vascular thrombosis and multiple organ failure. Widespread fibrin deposition and hypercoagulable state of blood clots will form thrombosis intravascularly and lead to complications such as thrombocytopenia, ischemia, low tissue perfusion and hypoxia, shock, and multiple organ failure. First, thrombocytopenia. Thrombocytopenia is a condition where blood clots form intravascularly around systemic circulation due to insufficiency of platelets and will lead to prolonged bleeding. Next, the formation of thrombus in the vascula will interrupt the blood flows in order to provide adequate oxygenated blood to the cells and tissue, thus causing ischemia and low tissue perfusion. This will then lead to inadequate blood flow and oxygen deprivation, hypoxia. People with DIC also will develop shock when they are in a state of low blood perfusion or not enough blood flows throughout the body, causing the damage to the cells and tissue. The thrombosis clamp in the blood vessel will then contribute to multiple organ failure. If the thrombus form in the deep vein, it will cause lung dysfunction, while the thrombus formation in the arteries will lead to heart failure and brain damage. Venous thromboembolism, also known as deep vein thrombosis, occur when a blood clot forms in a vein located deep in your body. usually at the lower leg, thigh, and pelvis. Thrombus formation at the deep vein will restrict the deoxygenated blood flow, causing low volume of blood reach to the heart. The clot will cause damage with the symptom of bluish or pale affected areas, leg cramping, and leg swelling. Since the systemic pressure exerted at deep veins are higher, it will cause the thrombus to break off from the vein membranes, forming embolism. The embolism will then travel through the circulation and block the pulmonary arteries, where this condition is known as pulmonary embolism. This will then restrict the blood flow to the lungs and damage it. Arterial thrombosis or thrombus formation in the artery will limit the blood flow and lead to myocardial infarction or heart attack. Heart attack happen when the flow of oxygen-rich blood to a section of heart muscle suddenly become blocked, and the heart can't get oxygen. If blood flow isn't restored quickly, the section of heart muscle begin to die. The arterial blockage will also lead to stroke. A stroke happens when the blood flow to the brain is blocked by the thrombus or plaque formation in the artery. This prevents the brain from getting oxygen and nutrients from the blood and begins to die within minutes.
DIC can occur due to overconsumption of platelet and coagulation factor. It will cause depletion of platelet and coagulation factor. Body use platelet faster than it produce. It causes a shortage of platelet in the blood circulation and production. This condition is known as thrombocytopenia. Thrombocytopenia can cause easy and excessive bruising under the skin. Low blood platelet and fibrinogen count with the presence of D-dimer can cause prolonged bleeding. The bleeding is most often at nose, gums, bladder, GIT, and stools. Hemolytic anemia can occur caused by mechanical destruction of red cell and platelet in microvascular. People who have severe hemolytic anemia can be fatal if it is not properly treated.
Hi everyone, this is the treatment and management of the DIC patient. In this case, the suspected cause of DIC is the venomous snake that the man got when he was bitten by the snake. As such, antivenom serum, particularly antivenom serum for hematotoxin, needed to be administered to the patient either by slow intravenous injection or intravenous infusion. For slow intravenous injection was at a rate of 2 ml per minute, and for intravenous infusion, the antivenom diluted in 5 to 10 ml per kg body weight of normal saline or dextrose 5% solution and infused over 1 hour.
For the following days, due to the slow progression of DIC symptoms, heparin administration may be considered to relieve or decrease the symptoms of DIC in a patient. Heparin is given for several days to control DIC and to increase fibrinogen and platelet levels and decrease excessive coagulation factor consumption.